recording this from my quarantined house. This is the third time I've had to do it because I am so bad at hair and makeup. But I wanted to talk about pulmonary fibrosis. Some of you may be wondering, if I get COVID-19, will I get fibrosis in my lungs? And this is actually a question one of the divers at work brought to my attention, as it affects their physical qualifications to be a diver. And because a lot of people are into CrossFit, I think that this was a good topic to go over. Definitely like, subscribe if you find that this is helpful and you want to stay up to date on different topics like this. So for those that don't know yet, SARS-CoV-2 is the actual strain of virus that everyone in the media is talking about and has been calling coronavirus. So how can fibrosis affect divers and athletes if you get infected by SARS-CoV-2? So fibrosis can happen in more than just your lungs. It can happen in your brain, your arteries, and your heart even. So a really good way to think about fibrosis is it's actually scarring. It's essentially remodeling of the tissue after repeated episodes of inflammation. The scar tissue can make it really difficult for oxygen to be transferred to get to your blood at the tissue oxygenation interface in your lung tissue. So this can result in symptoms like shortness of breath while you exercise, even shortness of breath at rest. So this is obviously very much a concern for divers, as they rely on having a full lung capacity to do their job. Equally, athletes should be concerned as well, as this could cause a diminished exercise capacity as you exert yourself. So other conditions that can cause pulmonary fibrosis are from high amounts of radiation. Let's say you get diagnosed with a cancer in your chest area and you have to have treatment with radiation. That can cause what's called radiation-induced fibrosis. For COVID-19, we're obviously still learning a lot about the virus, and it's hard to give definitive predictions or percentages for the likelihood of developing a condition like fibrosis, especially in a regular, healthy young person. If you're concerned about fibrosis and reduced lung capacity, that means that you probably have already survived the infection, which is the most important thing. So as of March 24th, 2020, a very small study of only 12 hospitalized patients from China who were discharged showed that 2 to 3 out of those 12 had reduced lung function, possibly due to fibrosis. However, I could not find the exact article. This was from a news article, not from a published scientific article, and it's really hard to say if these patients who were discharged truly had fibrosis, because it's still very early on in the disease progression. We're still learning so much about the virus, and true pulmonary fibrosis may take a year to develop, but we also don't know if they had other environmental exposures, smoking history, if they've taken medications that cause fibrosis in the lungs. So at this time, we simply just don't know the true long-term effects of COVID-19. But I've definitely seen the word fibrosis thrown out there a lot. If you Google fibrosis, you might come across the term idiopathic pulmonary fibrosis. This is a chronic, long-lasting, and progressive condition that does have a very short survival rate of 2 to 5 years, and it's usually in older patients that are about 75 years old. So idiopathic, that word means that we just don't know what is causing it, and it's a complicated disease that you would definitely be followed by a pulmonologist for. viral infections, not necessarily COVID, but other viruses like Epstein-Barr, cytomegalovirus, ones that the population is used to seeing, in addition to being older, could predispose a patient to developing a condition like idiopathic pulmonary fibrosis down the road. But having repeated infections and multiple pneumonias are definitely of concern. So how would you know if you had diminished lung capacity? So after this whole pandemic is over and our healthcare system is not as burdened as it is or will be, you would get objective testing like pulmonary function testing. You would get a high-resolution CT scan of your lungs under very specific conditions. The main symptom that you would experience would be some type of shortness of breath after resolution of the infection. So additionally, you would see a pulmonologist to interpret these pulmonary function tests, these CT scans, and it may require further imaging. For conditions like idiopathic pulmonary fibrosis, sometimes that even requires a lung biopsy or a tissue sample of the lung to look under a microscope to confirm that diagnosis. So the best way to avoid all of this is to try not to get infected. As more and more cases are recorded, we are seeing more hospitalizations of younger people than predicted, and by young I mean ages 20 to 50 years old. If you are lucky and you will only get a minor cold, there's probably less of a chance that you will develop changes in your lungs. If you are hospitalized, intubated, you are diagnosed with a condition called ARDS or acute respiratory distress syndrome, or if you're placed on a ventilator, then that means your disease is more severe and you are having a higher likelihood of potentially getting lung changes in the long run, and hopefully you have survived the infection at that point. So I hope you learned something today. Please share this with someone who might be wondering this exact question. If you could, like and subscribe, and find me on Instagram at Mia_FitMD.